iliopsoas, below the inguinal ligament. We can't tell the difference between the two. So it's the combined iliacus and psoas major, so we just call it psoas, iliopsoas. Then as we go medial to that, we have pectineus. Now on the charts, there is no femoral artery or nerve to help you out. So here would be psoas major, that's 48, 50 would be pectineus, and then 61 would be adductor longus. Okay, so you're kind of rotating from lateral to medial. On your diagram in your lab manual, pectineus would be D, and iliopsoas is labeled just lateral to that. This longer muscle, more cord-like, is adductor longus, and that is D, as in boy. Adductor longus is D. And then adductor magnus is partially covered by gracilis or gracilis, and you can see adductor magnus down here, and you can see adductor magnus up here. And if we take off the hamstring muscles, remember I said in lecture, you can see most of that adductor magnus from the posterior view. It also functions as an extension because it has such a posterior mass. So adductor magnus is going to be here, here, and then all of this back here. So adductor magnus, and you're seeing just a little bit on your diagram, and that's letter C. If you look on the posterior charts, it can be a, here's the superficial view, so biceps femoris long head, semimembranosus and semitendinosus are in place. On this side, they're gone, so on the medial aspect, this whole large muscle right here is adductor magnus. Okay? It's named, it's a big muscle. And that would be the little bit that you're seeing is going to be letter C. So what's the nerve of the medial compartment of the thigh? Passes through the nerve passes through the obturator foramen. Obturator nerve. All right, let's turn to page 96, 97 and do the compartments of the leg. So posterior compartment has two layers. See the gap here between the calcaneus tendon and the tendons of our deeper muscles? So these two muscles are cut on your diagram. You have the two heads of the gastrocnemius. And we take off this head, you can see the soleus. Soleus, gastrocnemius, remember, crosses the knee joint. Soleus does not. And you can see soleus is a much bigger muscle if you look on the deep surface as well, because it comes much farther down the tendon. Gastrocnemius is very short. So gastrocnemius is A and B on your diagram, and soleus is C.
So this is the
Yes, medial and lateral heads. Okay, so A is going to be the medial head, and B is the lateral head. And then soleus is cut. It doesn't have separate heads. Now we see the three deep muscles of the posterior compartment, innervated by this nerve, which is the tibial nerve. And again, nerves will be the 6 extra credit questions on the lecture exam, where I have you matching them to compartment or to muscle. And I won't ask you to identify nerves in lab. Okay, we'll be doing that with our next unit, but you already have a head start on those terms. So we have 3 deep muscles. The smaller one that we can see in the very middle is tibialis posterior, and that is letter E in your diagram. And then remember, the fibulas are a lateral bone. Coming off the fibula, crossing over to the big toe is flexor hallucis longus. And coming off the tibia is flexor digitorum longus. So F is going to be, not F, here, yeah. The lateral muscle D is extensor hallucis muscle, sorry, flexor hallucis longus, and F is flexor digitorum longus. So this was Tom, Dick, and Harry that I was talking about earlier. So if you follow these muscles, their 3 tendons will pass behind the medial malleolus. Here's medial malleolus, big toe side. You look posterior to that, you'll see the 3 tendons of these 3 muscles. one closest to the malleolus, you're seeing just a couple of inches of it. That's the tendon for tibialis posterior, which is top. And then as we move medial, the next tendon goes straight up. That's dick, so this is flexor digitorum longus. And the most medial tendon comes over to the most lateral tendon, but the most one closest to the midline is hairy or flexor hallucis longus. So you can go back to that if you get mixed up which of these two muscles is digitorum or hallucis longus. Or you can just learn them that on the tibia is flexor digitorum and on the fibula is flexor hallucis, whichever works best with your brain at this time. So that's posterior compartment. All 5 muscles are innervated by the tibial nerve. We have 3 muscles now to learn on the anterior compartment. Again, notice none of them cross the, actually lateral compartment comes next, so let's do that. We have 2 muscles on the lateral compartment, and none of them cross the knee joint. They pass posterior to the lateral malleolus, so they are going to do plantar flexion or dorsiflexion. The fibularis brevis and longus. Tendons pass posterior to the lateral malleolus. Plantar flexion or dorsiflexion? Plantar, because they're behind it, they're going to pull it down. So the more superficial muscle is fibularis longus. Your book says peroneus, that's an older name. You're welcome to use that if you're more comfortable with it. The deeper muscle, and you can see its tendon is short. It looks short anyway because it's going all the way under the foot. It disappears. The deeper muscle has its tendon attaching to the 5th metatarsal, and that's fibularis brevis. Those are really hard to find on the diagram in your lab manual, but again, if you go to deeper muscle, it's fibularis brevis. That's going to be H. And the superficial muscle is fibularis longus, that's G. They're a whole lot easier to identify on the model itself. The brevis has a short attachment, that's the 5th metatarsal, so that's going to be this tendon right here. Okay. Going to the 5th metatarsal. Longest tendon disappears behind it. And we have 3 muscles in the part.
What's the 5th digit one? What's,
fibularis brevis, or peroneus brevis. Because the other one crosses under the foot to the 1st metatarsal, so it has a much longer pathway. 3 muscles on the anterior compartment. The one closest to the tibia is tibialis anterior, and you can see its tendon attaching right here to 1st metatarsal. So that is going to be letter I. Then we have extensor digitorum longus, and its tendons go out to digits 2, 3, 4, and 5, and that's letter K. And between the two, you can see just a slip of a muscle, but you can clearly see its tendon going to the big toe, and that's extensor hallucis longus. All right, so that's going to be letter J. Do not be the person that puts flexor muscles on the anterior compartment and extensor muscles on the posterior compartment, okay? If you're not sure, wiggle your toes and feel which muscles you have to move. So all of your flexors are posterior compartment of the leg. Extensors are anterior compartment. So we have a flexor digitorum longus and a flexor hallucis longus. We have an extensor digitorum longus and extensor hallucis longus on the anterior aspect. Okay? All right, that's it. You will not be tested in lecture or in lab on pages 98 and 99.